Welcome to the deep dive. Today, we're tackling a subject that definitely gets strong reactions and is often, well, simplified: pyromania.
hmm
The sources you are interested in suggest you're looking to get past the headlines, really understand the condition.
Exactly. We're aiming for clarity here, not just sensationalism. We want to dig into how psychiatry actually defines and sees pyromania.
Okay.
So unpacking what it is, its characteristics, maybe where it comes from according to research, and how it's handled professionally.
And let's just state this up front very clearly. This isn't the same as arson.
Right. Crucial distinction.
Arson usually has a clear motive: money, revenge, something external. Pyromania, as we'll see, seems to work differently.
Fundamentally differently, yes. So the core definition, what is pyromania? The constant theme in the sources is this repeated failure to control these really strong urges to set fires.
Okay, a recurring failure. So it's not a one-off thing?
No, it's a pattern.
And there's a sort of experience around it, a cycle.
Yes, definitely. Both the ICD-11 and the DSM-5-TR,
Yeah.
the main diagnostic manuals, they highlight this pattern.
Right.
Typically, someone with pyromania feels this growing tension or emotional arousal before setting a fire.
Okay.
Then during the act itself, there's this real fascination and intense interest, sometimes even pleasure or a feeling of gratification,
And afterwards,
relief. That seems key. The tension dissipates.
right, that release. The ICB-11 definition you pointed out is pretty specific: multiple attempts, aimed at property or objects, but without an obvious external reason.
Exactly. No money, no revenge, no political statement. And it notes it's not tied to things like intellectual disability or
Right.
just being under the influence or some other mental disorder causing it directly.
In the DSM-5-TR, similar idea.
Very similar. It emphasizes multiple episodes of deliberate, purposeful fire setting driven by that internal cycle.
It's interesting how the understanding itself has changed over time, hasn't it, within psychiatry?
Oh, absolutely.
Okay.
If you look back at the very first DSM-I in 1952, it was actually listed as a kind of obsessive-compulsive thing.
Wow. OCD, that feels quite different from impulse control.
It does now, yes.
Hmm.
Then, interestingly, it vanished completely from DSM-2.
It's dropped.
Yep, but it came back in DSM-3, and that's when it was put under impulse control disorders.
Ah, okay.
And now in DSM-5, it's within a broader category: disruptive impulse control and conduct disorders.
So the focus has really zeroed in on that lack of control over the urge.
Precisely. It reflects this better understanding that the core problem is managing that powerful impulse.
Okay. So we've established it's distinct from arson. What other lines do we need to draw? You mentioned other fire-setting behaviors.
Well, a common one, especially with younger people, is differentiating it from, normal childhood curiosity about fire.
Right, kids playing with matches isn't necessarily pyromania.
Exactly.
Uh,
That can be tricky sometimes, but pyromania has that recurrent failure to control the impulse, that tension release cycle. It's different from just exploring.
Makes sense. And what about common myths? Like, is there a connection to sexual gratification? Do you sometimes hear that kind of speculation?
Yeah, that's a persistent misconception. The sources are quite clear. It's actually very uncommon for the primary motivation in pyromania to be sexual arousal.
Okay, important to clear that up. Avoid stereotypes.
Definitely. The focus is really on that internal tension, the fascination with the fire itself, and the relief it brings, not these other drivers.
Okay, so shifting gears a bit, how common is this? Who tends to be affected?
The data suggests it's more prevalent in males than females,
Significantly so.
quite significantly, yeah. And the average age it tends to start is around 18.
18, okay.
And here's a really interesting, almost paradoxical detail.
Oh,
Individuals with pyromania are often drawn to the fires they set, or even other fires. They might hang around fire scenes, frequent fire departments.
that does seem counterintuitive. Why be drawn to the aftermath or the response?
Yeah, it just seems to highlight that intense fascination, that connection they have to fire itself.
Yeah.
It's powerful.
Wow.
Some even end up becoming firefighters or volunteers, which is complex.
Definitely complex. And prevalence numbers. You mentioned some inpatient figures.
Yeah, in psychiatric inpatient settings, studies report rates somewhere between, say, 3 and 6%.
But that's in patients. What about the general population?
That's where it gets murky. Experts generally think it's significantly underdiagnosed out in the community.
Why would that be? Just the secrecy.
That's a huge part of it. I mean, setting fires deliberately is illegal, right? So there's immense shame, secrecy, fear of consequences if you disclose it.
Understandable.
Plus, there might be issues on the clinical side, too. Maybe not enough awareness or specific training for clinicians. And Honestly, research funding in this specific area hasn't been massive.
So a mix of factors leading to potentially misdiagnoses.
Right. And that underdiagnosis means we probably don't grasp its true impact, and it makes things like public health strategies or early intervention harder to develop.
Okay, that makes sense. So if it's underdiagnosed but clearly exists, what do the sources suggest might cause it? What are the contributing factors?
Research generally points to two main buckets: individual factors and environmental ones.
Let's start with environmental. What kind of things?
Things like parental neglect during childhood, early experiences of physical or emotional abuse,
Mm.
even just seeing fire used inappropriately growing up.
So early life experiences seem important.
Very much so. Some studies also mention a link with growing up without a father figure present, though that's more correlational.
Okay.
And for some, fire might just become a way to cope, maybe with stress or even just boredom, a lack of stimulation,
Yeah.
a maladaptive coping mechanism.
Right, using it to fill a void or manage difficult feelings. And the individual factors, what's going on inside the person?
Often, feelings of inadequacy seem central. And these feelings might well stem from those environmental things we just talked about.
It connects back.
Exactly. Then there's the buildup of stress, could be chronic stress, could be specific events acting as triggers.
And the urge itself.
Yes, that's crucial. That intrinsic drive or urge to set the fire, which then leads to the tension release and that physiological arousal, the rush, the pleasure, that acts as a really powerful positive reinforcement.
So it becomes self-perpetuating in a way. Urge, act, relief reinforces the urge.
Pretty much. It's a complex loop between their history, their internal state, and this specific powerful impulse connected to fire.
Now, you touched on this earlier. Fire setting isn't only a symptom of pyromania, it can show up elsewhere. How does that complicate things?
Hugely. Misdiagnosis is a real risk here.
Like,
Well, you might see fire setting in someone with bipolar disorder, especially during a manic phase when impulsivity is high,
oh, okay.
or in someone with a substance use disorder, acting impulsively while intoxicated. Certain personality disorders might also involve impulsive acts like fire setting.
So how do clinicians tell the difference? How do they land on a pyromania diagnosis specifically?
The absolute key is that the fire setting has to occur on its own, essentially. It can't just be happening because someone is, say, drunk or high or solely explained by a manic episode.
So it needs to be the primary driver, independent of those other states or conditions.
Exactly. If the fire setting only occurs during substance intoxication, you wouldn't diagnose pyromania itself. You'd address the substance use. It's about finding the root cause of that specific behavior pattern.
That complexity must make treatment challenging too. What approaches are used?
Yeah, treatment really varies. It depends a lot on the person's age and how severe the pyromania is.
Let's take kids and teenagers first.
For younger people, cognitive behavioral therapy, or CBT, is usually the main strategy.
How does that work?
It involves trying to figure out the underlying reasons for the impulsive behavior and then using repeated therapy sessions to help them manage it. But it's often not just the child.
Involving the family.
Yes, very often. Things like parenting training, family therapy sessions, also maybe behavior contracts, teaching problem-solving skills, relaxation techniques.
Practical tools.
Right. And of course, fire safety education is crucial. Sometimes medication might be considered too. Generally, the prognosis, the outlook is seen as more positive for children and adolescents.
That's good to hear. But the sources suggested it's tougher with adults.
Unfortunately, yes. Often adults are less cooperative with treatment.
Why is that? Just the ingrained nature of it.
That's likely part of it. Treatment usually involves a combination of things. Maybe medication to help manage underlying stress or emotional volatility, plus long-term psychotherapy.
And the success rate.
It tends to be lower for adults. The condition can become chronic. And there's a risk that even if the fire setting itself stops, another impulsive behavior might emerge to take its place.
Like what?
Things like compulsive gambling, maybe other risky behaviors. It's like the underlying impulse control issue finds another outlet.
So managing the impulse is key, not just the specific act of fire setting.
Absolutely. For adults, research on specific treatments is more limited, but CBT approaches are still used. They focus on identifying triggers for the urges, developing coping skills, building healthier social skills.
And medication for adults, you mentioned it?
Yeah, there's no single pyromania pill, unfortunately.
Yeah.
But medications like SSRIs, which affect serotonin, a neurotransmitter linked to impulse control, are sometimes used.
Okay.
Also, certain anti-epileptic drugs, lithium, sometimes atypical antipsychotics. But often these are targeting co-occurring conditions like depression, or anxiety, as much as the impulsivity itself.
It really sounds like treatment has to be highly tailored to the individual.
Definitely. Given the complexity, the potential for other conditions,
Yeah.
it has to be personalized.
Our sources also mention some historical bits and interesting facts.
Yeah, a couple of things. Historically, back in the 1800s, before it got formally classified as we know it, pyromania was sometimes linked to this idea of moral insanity.
Moral insanity. What did that mean back then?
It was sort of a catch-all for disorders of emotion or behavior that didn't seem to involve obvious intellectual problems. A disorder of feeling or habit, essentially.
Interesting. And you mentioned it's linked to arson earlier, despite the motivational difference.
Right. Even though the reason for setting the fire is different, pyromania is apparently considered the second most common type of arson, statistically speaking, which is sobering.
Yeah, that highlights the real damage this impulse can cause. Any colloquial terms we should know?
Well, you hear firebug sometimes, especially in the US, or fire razor in the UK. But remember, those terms are often used loosely and can refer to arsonists too, not just pyromaniacs.
Got it. And how rare is it, really?
It seems genuinely rare. Most studies put the incidence at less than 1% of the population, and it only accounts for a small fraction of psychiatric hospital admissions.
Less than 1%. Wow. And it can start really young.
It can, even in children as young as 3, apparently, although that's very rare. But most children or teenagers arrested for arson are not diagnosed with pyromania. It's a small subset.
And the gender split again.
Yeah, that striking male prevalence, one source put it as high as 90%.
90%? That's huge. Any idea why?
The reasons aren't fully understood, honestly. It's an area needing more research. Hormonal factors, social conditioning. It's likely complex.
And there is some variation in older studies about how many fires were linked to pyromania.
Right. A 1979 study suggested maybe 14% of intentional fires involved pyromania or other mental illness. But a much earlier study from 1951 put the figure closer to 39% among intentional fire setters.
Quite a difference.
Yeah. Likely reflects changing definitions, diagnostic methods, maybe even societal factors over time. It shows it's been hard to pin down accurately.
It's definitely a challenge. Okay, before we wrap up, the outline mentioned a few related concepts just for context.
Yeah, just briefly, obviously there's the term child pyromaniac for when it manifests young. There's the really concerning issue of firefighter arson, where firefighters themselves set fires.
We touched on that paradox.
Right. And then distinct concepts like pyrophobia, an intense fear of fire, and pyrophilia, which is about sexual arousal related to fire. But again, that's separate from the impulse-driven nature of pyromania.
And the McDonald triad.
Ah, yes. That's an older, somewhat controversial idea linking childhood fire setting with animal cruelty and bedwetting as potential predictors of later violence. Its clinical value is debated now, but it comes up historically in relation to childhood fire setting.
So, lots of connected ideas around fire and psychology, but pyromania stands out with its specific impulse control core. Well, this has been a really, really insightful deep dive. We've moved way beyond the simple, often sensational image of pyromania. It's clearly a complex impulse control disorder, serious consequences for everyone involved.
Absolutely. The key takeaway is that it's driven by this compulsive need for tension release or gratification through fire, not malice. Understanding the complexity, the mix of causes, the treatment hurdles, it's all crucial for more informed view.
And it makes you think. Considering that intricate mix of personal history, internal drives, and this specific impulse leading to relief, what other behaviors, maybe ones that seem destructive on the surface, might actually be rooted in similar psychological loops? Impulse, tension, relief.
That's a fascinating question. The nature of impulse control itself is so fundamental.
Definitely something for you, the listener, to ponder. Thanks for joining me for this deep dive.